Okay, so now we're going to talk about removing a cannula. So when would you remove an IV cannula?
72 hours.
After 72 hours. When else? If it looks infected, so a VIP score equal to 2 or higher. Yep, and when else?
When they're leaving.
When they don't need it anymore. So if you look through the chart, the patient's not at risk for deteriorating, the patient doesn't have any IV medications, and the patient doesn't need IV fluids because they're drinking quite well, you can take that out. Or on discharge. Please do not send them back to the aged care facilities with catheters, cannulas, because it does happen.
Do we report to the RN before we take it out?
No.
Or we just take it out?
As a student you would, but once you're an EN, you are able to make those critical thinking decisions. Okay? All right, so I like to prep in advance, so I always peel my tape or prep it, and then I've got my gauze open and ready to go. Because again, at a certain stage, everything's gonna become, I'm only gonna be able to use one hand, okay? So, just like before when we were changing the dressing, you're going to loosen the tegaderm up to about 2 centimeters around your insertion site. So you can either just pull horizontally, which is the ideal way to loosen it, or if you have a person with very hairy hands, short, sharp tugs, okay? So now that it's loosened, which way do I want to peel the tape?
That way.
This way, because I'm going to be pulling the cannula out. Now it is in a vein. Veins bleed a lot, okay? It's not an artery, so it's not going to be spurting out, but think of it like a faucet. It will run, and it will be a lot of blood if you let it flow naturally. The cool thing is, as much blood as what could come out, it doesn't actually hurt the patient. The tape is the only part of this procedure that causes a little discomfort. So sometimes you might see patients actually accidentally pull out their cannulas just because it gets caught on something and they come out and there's blood everywhere. They're not in pain. It just looks scarier than what it is. So because there's going to be bleeding, I have gauze and I'm wearing my clean gloves to protect myself. So I pull out the gauze. And what I do is I like to fold it into just a little square. And now I'm going to pull my tegaderm back, leaving the catheter still in the patient, and I'm going to have my gauze ready to go. Now if I immediately put it on, it's going to get caught up with the tape. So I kind of prep my gauze to put it down as soon as I start pulling out. Does that make sense? One hand's holding the gauze, the other is gathering up the tape and the catheter, the IV cannula, and then I start pulling out. Once I get slightly out, I start putting more pressure on the gauze holding it. So now my gauze is down, my cannula is still technically in the skin, it's just on the very edge, and then I pull out. My finger is holding pressure directly in the middle, okay? For a healthy person who is not on anticoagulants, you will hold pressure for 1 minute. For a patient who is on anticoagulants, you will hold pressure for a minimum of 3 minutes, up to as long as 10 minutes, okay? Now, standing here for 10 minutes, that is going to be a very long time as a nurse. There's a lot I could get done in 10 minutes. So what can I do?
Put the tape on.
So I can put tape on, absolutely.
To hold it for you.
Yes, so the tape is not going to, in itself, hold enough pressure. So what I do is I take the patient's finger, and I put the patient's finger on there. Is it acceptable to ask a family member to hold pressure?
Yes.
No. Not if the patient's able to do it themselves.
If the patient's able to do it themselves, then ideally I'd ask the patient. If the patient can't do it themselves, is it okay to ask a family member?
Yes.
Yes. Okay. You ask them if they're comfortable. Are you comfortable to hold pressure? But most people have dealt with this sort of gauze and tape situation when they've had blood drawn before, and the pathologist asks them to hold pressure for themselves. So if you think about it, if it was your mom and you're sitting there and the nurse goes, we just need to hold pressure for a few minutes, and your mom's not capable of doing that, and the nurse turns to you and goes, do you mind holding some pressure? Most people would be like, yeah, no problem. Okay? And then you say after a few minutes, it should stop bleeding. But if it doesn't stop bleeding, just keep holding pressure and give me a buzz on the call bell and I'll come back and take a look. Okay? If it doesn't stop bleeding, what we do is we can wrap bandages around to increase the pressure and maintain the pressure, and we can also apply an ice pack. However, I'd say 99 times out of 100, it stops bleeding definitely within 10 minutes. Okay? This here, a lot of facilities would like you to put it in a sharp spin. However, technically, it's not a sharp. So if your facility does not have that rule, you may put it in the rubbish bin. Okay?